Good evening, everyone. It's Dr. Tom Warcup from the Rhode Island Medical Center.
And Laurie Anderson, the nurse practitioner from the Medical Center.
Today is March 11th. Today is pandemic day 367. It's hard to believe that it's been over a year since the CDC designated coronavirus a pandemic. We continue to do very well in the region. Rhode Island had a small uptick in their positivity rate over the last 7 days from 2.1 up to 2.4. Massachusetts has held steady at 1.75, and Connecticut has drifted up to 3.54. Overall, we've been doing very well on the island. Over the past 2 weeks, we've had 4 additional cases of coronavirus, so it is in our community. The previous 4 weeks from that, we didn't have anything, so we've been doing well, staying strong. But please remember that it is in our community and we want to stay vigilant. Since many people are now getting vaccinated, the CDC has made some updates to precautions.
Which is great news. You can see that Dr. Warcup and I are maskless tonight, and that's part of the new recommendations, that if you're fully vaccinated, you can be indoors with others who are vaccinated or unvaccinated without social distancing, without masks, and you can be visiting individuals in a household who have low risk of COVID-19 disease because you're fully vaccinated. So that's great for grandparents who want to go visit their grandchildren.
And a vaccine update that right now the U.S. is vaccinating more than 2.2 million people per day, with last Saturday topping out at 2.9 million, which is terrific. For those individuals like us and everybody here on the island that got Moderna vaccine, a study that came out on March 5th showed that the Moderna vaccine is positive against the UK variant. And the UK variant that you've heard about in the past, which was formerly about 3% of the coronavirus variants, is now 33% of the total coronavirus penetration in the US. So we do have the right vaccine for that, but it does show that there are increasing transmissibility issues with other variants. On the local news, 21.5% of Rhode Islanders have received at least 1 dose of the vaccine, and 8.6% are fully vaccinated. And on a very local note, Block Island has had over 450 people vaccinated. We have successfully vaccinated everybody 65 and older that we know of. We've vaccinated all people with COPD that are 50 and older. All EMS personnel that would have preferred to be vaccinated have been vaccinated. And fortunately, tonight we just wrapped up doing our first round for our teachers. So we are in a period where we can start getting into some more medical priorities as we get additional vaccines. So it's been a proud moment for the whole community.
Another interesting thing is that there's a new medication in development in experimental stages that is kind of like the Tamiflu that we use for influenza, but it's going to be available to treat people with COVID disease and to reduce their symptoms. Abbott Pharmaceuticals also announced this past week that they have a new test that will be coming out, and it's gotten emergency use authorization that will be able to distinguish between COVID-19 cases and flu cases and RSV, which is a common respiratory illness in children. So that's good news on the testing front. But as Dr. Warcup pointed out, there is still disease, there's still COVID-19 disease in the community. And so it's really important, even if you're vaccinated, when you're out and about, to maintain your social distancing, wear your mask, hand wash frequently, and stay the course. And get out and enjoy this beautiful weather.
Great weather. Get out, enjoy the trails, enjoy the beaches. Remember that if you're out exercising by yourself, you don't have to wear a mask. But if you're with other people, please stick to the rules and be smart about it. We're almost there. Hang in there. We'll talk to you soon.